right, folks, good afternoon. And it is that time of the week. We're halfway there. It's the middle of the week. Happy Wellness Wednesday. This is the Marketplace Show Reset, segment number 1 on our health, wellness, and lifestyle. I'm Anthony Weeks, and I'm joined by my colleagues. We have Linda Dorman. She is the producer and contributor of this segment, joined by our co-host, both Yvette Wood and former Congresswoman Donna Christensen, and also a medical doctor as well. And we have a special guest always in the house. And this is where we have an open dialogue, open conversation about not my health, but your health, our health. And but before we get into that, I want to say that today is historic because we are literally doing a, if you will, a pre-launch of the Kalalu new, if you will, channel that will be airing on Roku, but it's live right now, live streaming on our live television platform on our website. Unlike before, we were only sharing our content with our partners on various television and radio platform. What it means after 15 years of literally producing and live streaming events and live broadcasting, the Kalalu Network has launched its television channel platform, and this at the end of the week or over the weekend, we should go live on Roku, and Roku will get in. We'll talk about the details about what all this means on the segment number 3 on technology and e-commerce on our Tech Talk segment with my colleague Michael Gerard on that segment. So we have a lot to share with you, but for now, I just want you to know, if you would like, so if you're listening on radio and if you're not on television, you can't watch it, you can't be in front of a television, you're able to watch this right now live on our live streaming live TV platform at www.ourtv.network. Again, you go to www.ourtv.network. That's the homepage, and you will see that this is the, if you will, the test broadcast, if you will. The actual, all of our programming will be officially launched on Sunday. We have partnered with various organizations. As you know, one of our properties is the Caribbean Food Network and CFN. And CFN has partnered with the Taste of St. Croix and other organizations, nonprofit organization. We've partnered with the governor's office, Governor Albert Bryan, to help him with his effort to help spread the word as to getting vaccinated. So we're having a social event at the Buccaneer this Sunday. It's a celebrity chef food demo that's going to take place at the Buccaneer Hotel. We partner with the Buccaneer Hotel, one of our 5-star hotels. And what we're going to have an opportunity for those who are vaccinated, if you're vaccinated, you'll be able to attend the event and get a great presentation on the celebrity chef food demonstration and socialize with other like-minded folks who have been vaccinated. So again, we all make choices, whatever your choices are. It's not right or wrong, but it's your choice. But obviously, people have to make decisions that's in their best interest. And so going forward, if we're going to reach herd immunity, if we're going to resume some normalcy, well, all of us are going to have to be on the same page. And so clearly, the governor is working hard to reach that herd immunity. I think he said 70%. Donna, I think you can correct me.
At least.
And so therefore, this is just an example of many social activity and event that the governor is advocating to get people to re-engage, but making sure that you're vaccinated. And so on Sunday will be our actual official premiere, official launch of the new Kalalu Media live television platform, our TV network, and we invite you to be part of that. And so we'll be talking more about that later on today on segment number 3. So ladies, thank you for indulging me, for sharing that information. It's been 15 years. We're excited, and we've come a long way. And we now have an opportunity to do some great things around the country. Roku has 52 million users. There are 52 million Roku television and devices in the country and around the world. And so therefore, when you want to watch Amazon, when you want to watch Netflix, you want to watch Hulu and all the other streaming platforms, if you have a Roku television or Roku device, you'll be able to not only watch our program, but you'll be able to watch the normal movies that you normally watch on those different streaming platforms, because we now have our own OTT platform, and it is called Our Network. And so thank you, ladies, for allowing me to share that.
And, the vaccination only, I think, is a good incentive rather than a punitive way to get people more interested in vaccinations. I have a medical school class reunion next weekend, and everybody has to be vaccinated.
That's excellent. That's important to lead the way, to model the opportunity. And that's, of course, we know those who have immune compromised or who are compromised in their immune systems may need to really have the guidance and support of their physicians. We know there are breakout cases.
Yes.
And we have to appreciate the fact that when you are vaccinated, fully vaccinated, that your chance of survival is exponentially positive. And you may not even have significant symptoms. So I applaud that reunion group and organizers. And Dr. Christensen, I hope you have a
Well, it's a medical school. They better be ready. They better be on the right side of this pandemic.
Oh, they better be on the right side of this. Yes, there's no question about it, because we are seeing so many stories in the news right now of parents who are passing, who are dying, mother, father, leaving their children, whole families without parents. Yeah. And it's striking when you see this over and over and over. And some would criticize the media for sensationalizing it based on the numbers, but it drives home the reality check that we have to get to herd immunity. And we applaud the U.S. Virgin Islands for having, 70%, or it's getting...
No, that's what we would like to get.
That's what you would like. That's what
we're really far away from it. So the governor and the Department of Health have tried any number of incentives, from lotteries to gift cards to also doing pop-up testing wherever, all over the territory. And but I think the vaccination only it's a different kind of incentive. I mean, it doesn't force you to do it. It's not really discriminatory against, because you have an opportunity to be vaccinated and attend. So I think that's a helpful way. And it also rewards those people who have taken the step to become vaccinated and to adhere to all of the public health advice.
Yes, and we just have to get into the social media trek, because this is where a lot of our dismiss and just wrong information, however you want to call it, information is disseminated, and people bite off of it and they swallow it whole. And it's
amazing.
hard.
It's amazing.
I'm going to give it a new name, but it's no longer going to be called social media. I'm going to call it social disorder.
Oh, I love that, Anthony.
That's better.
Social disorder. When you have kind of, bravo.
Yeah, well, it can also give good information too. Whenever I find information, good or bad, that makes.
Well, I don't know about that. I don't know about that, because I mean, in the last presidential, last administration, fake news was given birth because of social media. Now it continues with this whole pandemic. So there's a consistency where social media is being manipulated, cajole, connive, using in all the worst way. I mean, it's meant to do good, but I mean, I mean, there are all kinds of bad actors and bad characters
and
that are
some of
really
them are not
exploiting
even in this
media.
country.
And it's
Some of them are foreign.
Absolutely.
Yeah.
You know, and it's where a lot of individuals get their news. That's the scariest thing. But then you also have the responsibility of credible news services that should be doing their due diligence, their fact checking, you know, have their opinions of their anchors and reporters in check and be in a position to deliver what we used to have in the journalistic arena, a sense of journalistic integrity. It's not about opinion. It's not about hyperbole. It's not about, you know, my thoughts or sensationalism or ratings. It's really just making sure that we can get information that is useful to the listener and the viewer out there. And this is just the most unexpected twist and turn that we have taken, that we just do not have a sense of common sense within it. So I don't know, Yvette, what do you think?
I think
It's
the
it's
viewer
the
has
wild, wild west.
a
The
responsibility.
wild, wild west.
Yeah, the viewer has a responsibility to balance out that information. Just like, you know, say, let's take the presidential election, for instance. I would watch CNN and then I'd flip over to Fox. I was balancing my information because somewhere in between the middle lies the truth. And so
Yeah.
if the viewer starts taking some responsibility for the information they're receiving, then they can better make a judgment as to if the information I'm receiving is factual or fiction.
Yeah.
And then they take that balance and put their own spin on it. And that's where we have that social, what did you call it? Disease.
Disorder.
Yeah, social disorder.
Social disorder.
Yeah,
Yeah.
that's social disorder. That's what it is.
Propaganda, amok propaganda gone wild.
There you go.
And they're gone wild.
So today's question, and before I exit and bring our guests on, that is the question of the day. Is social media doing more good than harm? Are you using social media to do good, or are you using social media to do harm? Because again, the dissemination of information is there to share that information, but the propaganda campaign behind the fake news, just the disorder of that social platform is a problem, and so, you know, the question you have to ask yourself when you use social media. Are you doing it in a responsible way, or are you doing it because it's something there that gives you a platform and it gives you your 15 minutes of fame? And what do you do with that 15 minutes of fame? You go out there and you just, I don't know, whatever, anything goes. So it's the wild, wild west. So anyway, ladies, let you do your thing. I'm going backstage. Bring your guests on and have a great show, guys.
Thank you. And we'll think about that question when you come back. So, because that is a question to ask. Is it doing more harm than good? Are we getting our medical information from those who are coming from the doctors versus those who are doctors? It's a big question. And I think it's a little bit of both, frankly. I think I guess we can talk about it right now until our guest comes and joins us. You know, I think there's lots of good that can be derived from social media. And then I think there is harm. So therein lies the balance.
Yes.
Yes. Ms. Weaver, turn on your mic so we can hear your lovely voice, because we have a lot of questions and we have a lot of things we want to chat with you about the subject of being a midwife.
Yes.
So do you want us to do us the
Can
honors?
you ladies? Sure. Dina Weaver is a great nurse. I have known Dina since she was maybe 14 years old. I had the pleasure of watching her grow up and become a wife. She was married to my little brother who blew it. So she's still my sister-in-law. Paperwork has nothing to do with love. I had the pleasure of sharing a doula role with her at the delivery of her birth of her nephew. I was the doula, and it was a 36-hour birth, and I was wearing linen, and Dina stepped up to the plate to give me some reprieve from that birth. Since that time, she has gone on to further her education. She has a weekly broadcast on Wednesdays where she gives women the best healthcare tips, and we're going to talk about one of those today, cervical health. That's something that we don't address quite enough until it becomes cancerous. So welcome Nurse Extraordinaire Dina Weaver to join our broadcast today. Hi, Dina.
Welcome, welcome. And we want to make sure that we give you all your flowers, your certified nurse midwifery. And we're going to talk about what exactly does that mean. And then you gave us a term just a minute ago, Yvette, doula. So for those who are not familiar with those kinds of terms, we want to make sure we get a clear definition for them, but definitely welcome. So are you missing?
Thank you very much. Say that one more time.
Are you missing your broadcast today? Or are you doing double duty?
No, I record it and then I post it. Like I record a video and then post it on Facebook and Instagram.
We love technology. Well, tell us, since you've known Yvette since you were 14, and I can't say that you look a lot older than that. Can you tell us what drove you into, what was your inspiration to become a certified nurse midwifery?
Yes. So I'm actually a student. I'm a student midwife, but I will be graduating next year in August. I've been a registered nurse for 15 years now, and kind of what took me on my journey to becoming a midwife is just in working in management capacity. I started to learn about some of the health disparities that are experienced specifically by Black women and other minority women of color, and just really wanted to make an impact on that. And that's what kind of sent me down the path of becoming a midwife.
Excellent. And how wide of an industry is this? I mean, what's our, feeling for midwifery as a career? Is that a career choice? Is that an additional specialty? Kind of give us the lay of the land. Should nurses?
Yes.
Let us know.
So with midwifery, there's actually different types of midwives. A certified midwife, but I'm studying become. It's an advanced practice. So it's a registered nurse that goes on to get her master's or her PhD, and then practices in basically an enhanced capacity. And then you also have certified midwives and you have lay midwives, which basically do some of the same things, but kind of take a different professional track to get there.
Can you talk about midwife and nurse midwife and doula? Are they interchangeable, or?
Good question.
Is there something different about the doula?
Yes, that's actually a really good question. It's something that I get asked quite often. So the difference, the two actually work hand in, but they're different. Doula has to do with kind of supporting the woman, supporting her partner or whoever her support person is, supporting them through the pregnancy, but specifically through labor and through delivery, and sometimes a little bit of support after delivery. But doulas provide any hands-on care. So they're hands-on and comfort measures, different things like that, but they don't provide any type of medical care. Versus with a midwife, midwives actually are able to deliver the baby. They're able to manage a pregnancy from start to finish. A lot of people, when they hear the term midwife, they just think specifically pregnancy, and they don't kind of factor in some of the other aspects. Midwives actually can handle all things women's health, basically from when a girl starts her menstrual cycle all the way through till menopause. So dealing with any complications with, if say a teenage girl, her cycles are irregular or she has really bad menstrual cramps, catch those types of things, can prescribe birth control, can do STD testing and treatment, diagnose the pregnancy, manage the pregnancy, and you can even actually get some certification to do some management in menopause as well.
That is really fascinating.
Yeah. I wasn't sure. I didn't realize that the doula couldn't also do the delivery. but the Virgin Islands has kind of gone backwards, because when I had my two children, there were midwives involved. I had a doctor delivery, but my Lamaze classes and all of that was done by a nurse midwife, and the nurse midwives really ran the maternity suite. And so, yeah, I had that experience many years ago.
And so that brings to mind, it sounds
Yeah.
like midwives also work hand in hand and side by side to gynecologists and obstetricians, because I know in my doctor's office, in my personal experience, I was very surprised when they said, well, the doctor's on vacation, but would you feel comfortable with a midwife? And I thought, a midwife? Well, I'm not having a baby. That was my first thought. And I said, well, sure. I had no idea the extensive repertoire of services that could be delivered as a midwife. So I'm glad that you made that distinction.
Absolutely. And during this pandemic, more women have chosen to give birth at home, which has brought midwifery to the forefront, and even doulas to the forefront, to support those birthing parents until the midwives arrive, because the demand for them has been so heavy. And as Linda, you were sharing earlier about COVID and the death of parents. But what we don't hear about a lot is, what are these pregnant women experiencing during COVID? So I'm hoping Dina can kind of shed some light on that. I mean, we hear very little about the women who are actually in the hospital that are pregnant and suffering from COVID. So I'm hoping Dina can help us understand what that picture looks like.
Absolutely. So I currently work as an antepartum, postpartum nurse at one of the main hospitals here in Cincinnati. And a lot of women, even from the beginning when COVID started, women were terrified, because nobody wanted to go to the hospital or go anywhere near the hospital, because they were so fearful that they could contract COVID. There was just so many unknowns. And so what actually wound up happening, unfortunately, is you home birth, but you really need to have a lot of preparation and planning for that. And so what was happening was, a lot of women didn't want to go to the hospital, so they were having these births at home, sometimes unattended. So no midwife, no physician or anything. And unfortunately, some of these babies weren't making it.
Wow. So
because there was no support.
There was no support. Oh, I know that we live in a day and age where we feel there's a lot of natural approaches that we want to take. One of the most fascinating is the water births, so that there's less stress on the mom and less stress on the baby. But it's not, as you mentioned, we encourage all of our listeners and viewers that if that is what you're electing to do, to have a home birth, for whatever the reason, it's critical that you not go it alone, that you consult.
Absolutely.
A midwife, consult the midwifery industry to know what services are available. And so how would someone go about learning more about this opportunity, this option?
So really the best way is either word of mouth, or you can talk to your provider. So the current practice that I'm doing my training with is with a group of midwives and nurse practitioners, but they're affiliated with physicians. So like what happens over the course of the pregnancy is that a woman will see the midwife or the nurse practitioner, and she'll also see the physician, and kind of alternate between visits. For women, we're seeing a provider who is a physician, but maybe doesn't have a midwife associated with their practice. They can definitely, go to Google sometimes and just really talk to whatever midwife that you're wanting to consider. Talk to them, kind of see if a home birth or a water birth is even an option, because depending on what's going on with the pregnancy and what complications could happen with baby, but mom as well, sometimes there's additional monitoring that's required, and it's not really feasible to do it a birth at home. But definitely, like you mentioned, as far as with making sure that you're not going at it alone, is that most babies come out and they're crying and everything is wonderful, but sometimes babies and they're not breathing, or whatever, too much blood. There's just so many different complications that can happen. But definitely, I would encourage all women to talk to your provider and see if a home birth or a water birth is even an option.
Excellent. Is that true also besides birth? Because you just educated us that midwifery has another list of services beyond pregnancy and birthing and post-pregnancy support. Are we able to consult midwifery to come into our homes to do our regular female wellness check? Because one of the topics that we want to make sure we have a lot of conversation on is our cervical health. And that starts with examinations and blood work and urine work, perhaps, and making sure that we understand what's happening to that part of the reproductive system.
And pap smear.
And pap smear, for sure.
Yes, absolutely. So typically most midwives, when it comes to like that kind of routine examinations and things like that, those are typically more done in the office that I'm aware of. Now, I'm sure somewhere within the world, I'm sure there are, midwives and physicians making to a patient's home, especially in your more rural areas. But primarily things like that are provided like in the doctor's office or in the clinic or something along those lines. But to speak to that kind of preventative screening as far as with cervical health is definitely something that is huge. And it is something that midwives are able to provide as well. It used to be that pap smears were done every year. Every year, women knew we had to go to the doctor and get your pap smear done. But the guidelines have actually changed.
Oh.
And so now it depends on kind of your age. Yes. So they're only recommended. The current guidelines are if you're under the age of 21, you don't get any type of pap smear or anything like that. And then from the age of 21 to 29, you get pap smears only, but we don't check for what's called HPV or human papilloma virus, which can be a sexually and so then from 30 to 65 is when you're doing the pap smear as well as the HPV testing. With HPV is basically a virus that can lead to cervical cancer. So the pap smear is looking for cancerous cells. Checking for HPV is kind of your red flag. If a patient has HPV, they need a little closer monitoring to make sure that the HPV doesn't evolve into cervical cancer.
Now, that's an interesting guideline because I have 2 teenage daughters. And when they were in their young adolescence, we obviously not obviously, but I elected to go ahead and have the various shot protocols to prevent HPV. And so
Yes.
They would not be checked until after they're 30, is what I'm hearing.
Yes.
Okay.
Yes, absolutely. We don't check until after 30. Yes. And the thing with that vaccine as well is that one key point that I wanted to mention is that it's really important that you get the vaccine before your child is sexually active. A lot of people think, okay, well, my child's not sexually active, so they don't necessarily need the HPV vaccine. We'll get it further down the line. When in all actuality, it's better to get vaccinated, get it in your system and everything, so that when your child does start to become sexually active, they've already been immunized.
Wow.
And a lot of times parents won't know when the child becomes sexually active. So the best thing to do is to do it early
at the first time
Exactly.
available. Well, that's really a great way to start your daughter's understanding about their reproductive health. Because that's a series of shots that they were not too happy about getting, but it opens up the uncomfortable but necessary conversation that we know that we must have, because in our conversation with Anthony, we talked about social disorder, and of course, lots of information is coming out around sexual health and all of that our young people are grabbing hold of and believing that they have the knowledge. So this is really an important public service announcement for that, for sure. So talk to us a little bit about what happens after 40. I mean, for the mature. Oh, wait a minute. Anthony, are you just coming
from the age
somebody in your life? You done popped in.
We need to take a quick break. We need to take a quick break. And if I guess, I'm not sure what connection you're using. You may want to try a different connection during the break, because you're freezing a lot. And so we're hearing you, but you're freezing a lot. So when we take a break, if you can check your internet connection and maybe use a different connection, that would be helpful. All right. Folks, we'll be right back. This is the Marketplace Show Reset, segment number 1 on our health, wellness, and lifestyle. We'll be right back.
Small business is a part of all of us each and every day. It's where we eat, it's where we shop, it's where we go to meet our friends and colleagues. In the wake of COVID-19, our small business community desperately needs our help. We must do our part to help our local communities to once again thrive. We must focus our attention on the small businesses that are the fabric of our great nation. SureUp is a network of small business owners, their employees, and local consumers all working in unison to support each other. By creating incentives for consumers to think local before considering regional and national providers to fulfill their needs, we create local job opportunities and rebuild our communities. In addition, through AI-driven tools and machine learning, in just 5 minutes a day, SureUp assists business owners in improving their social media presence, which enhances their visibility among consumers and levels the playing field so that local businesses can better compete with large, name-brand online competitors. When local businesses leverage the SureUp platform, full-time and part-time employees, whether W-2 or 1099, are rewarded with a variety of voluntary perks and member benefit options. These include discounts on the things people do every day, access to low-cost, subscription-based telehealth and teletherapy, discounted prescription drug plans, connection to exclusive Prosper resources, and so much more. All for less than the cost of a cup of coffee each day. The Jumpstart Marketplace is here to support the health and wellness of individual employees, as well as the health of businesses in the local communities in which we live and work. We're all in this together. So join us as we reinvigorate our local community and improve the physical and financial health of working America.
Well, we're back, and we thank you for joining us for this next 30 minutes to talk about cervical health, midwifery, and to speak with and to even communicate. So if you have questions for our expert today, please go to our Facebook page and give us your questions. So, Ms. Weaver, we were talking about what happens after 40. So you gave us the 20, 21 to 29, after 30, and then what happens to us as we think about our cervical health in particular after 40.
Yes. So actually, it's from 21 to 29 is where you only have the pap smear, and then from 30 to 65 is where we do both. So we check the pap smear to see if there are any cells that could potentially be cancerous in the cervix, and then we're also looking to see if you do have HPV as well. Now, the thing with HPV is that often our immune system can clear it, and it doesn't. So just because you test positive for HPV does not necessarily mean that it will progress to cancer, because it's one of the ones that our immune system can oftentimes clear. But in the event that it doesn't get cleared, then that's when it can turn into cancer. And then from 65 on is typically where, as long as you've had enough screenings that show negative for HPV and negative for cancerous cells after the age of 65, then you don't have to worry about the pap smears anymore. Or if you have a hysterectomy, then you don't have to worry about the pap smears, as long as the hysterectomy was not done because you had concerns for cancer.
Yes, and that's a very good point. That a couple of things that you just said that I think we should emphasize it. If you've had a hysterectomy, it's because why? You do not have a uterus to be able, or cervix, to have the pap smear. Doesn't mean that you would not still have an examination, correct?
Exactly. Yes. Okay. I'm glad.
Now, let me ask this question for our very active, and I mean sexually active 65 plus year olds. Because we know by numbers related to HIV among seniors that we have a very active, very spry, very sexually in tuned population.
Yes.
So would that still be a concern if that's the case, and they're not and they have not had a hysterectomy? They're
thank you for bringing that up, because even in those in between years, if you're not quite to the 3 years yet, or you're not at the 5-year mark yet, every year it's still really important that you either go see your gynecologist or midwife or nurse practitioner, whoever provides your women's health care. It's important that you go see them, because the pap smear only focuses on the cervix. There's still if you still have your uterus, there's still your uterus, your fallopian tubes, your ovaries. You still have the walls of your vagina. There's so many different components down there that besides the cervix. So it's really important that you still go every year. It's just not as involved. So we don't have to use a speculum and do all those other types of things. It's a little more relaxed and more of a check-in.
That's important information.
How often do you see subtotal hysterectomies where the cervix is still left in? How often?
Not very often. It seems like for the most part, all hysterectomies at this point they're leaving only the ovaries, unless there's something going on with the ovaries. They're actually removing the fallopian tubes as well, because if you're at increased risk for ovarian cancer, the risk increases if they leave the fallopian tubes in. So they're taking the cervix, the uterus, and the tubes and just leaving the ovaries. so that the woman doesn't have that drastic change in hormones, throwing them into menopause and increasing their risk for cardiovascular disease and bone density loss and all of those types of things that happen once a woman goes into menopause.
And that's a very good point for those women who are heading into menopause or in menopause who had a hysterectomy, but yet their ovaries remained. It's to prevent the drastic change overnight. You obviously lose your period or your menstrual cycle, and then you are automatically pushed into menopause, correct?
Yes, if they take your ovaries. Yes, it's like, yes.
Yeah.
Very
I had a hysterectomy and had my ovaries removed at the same time. I just didn't want to have to be worrying about ovarian cancer. So I just said, take it. And I was medicated for a while, and I weaned myself off of it over time. But ovarian cancers are among those that you often don't know you have until it's too late.
Yes.
Wow. Yes. And so did we just learn something, Dr. Christensen and Ms. Weaver and Yvette, you all being the clinical experts on this panel here in this conversation, is that if you take the fallopian tubes, you dramatically reduce your risk for ovarian cancer. So if you're heading into that type of procedure, and that's something to make sure as a patient and be competent in that conversation with your physician, you should inquire about.
Yes, absolutely.
And I was not a young, I would imagine it's a difference in age. I was not a young chippy when I had my hysterectomy. So it was, I was nearing menopause anyway.
Okay, well then you must have had a rebirth, because I think you're young and chippy right now. So, so it did well. Yeah. So how do we begin to understand what are the ways that we do detect? Is it just something we can't feel it? We can't see any changes in our body? Are we having other hormonal issues that would give us some clues if we are experiencing some type of cervical cancer of some type? Or is it strictly through blood and urine and whatever other exams are appropriate?
So sometimes when you're dealing with cancers that have to do with your reproductive organs, your uterus, your cervix, all of that, you may notice some pain. You may notice some abnormal bleeding. Those are all red flags. Anytime there's a change, one thing I always talk to women about is about knowing your body, knowing what your normally is. Because if you know what your normal is, you're more likely to be able to pick up on when something changes. So if you notice, anytime you notice a change in your menstrual cycles, maybe they didn't used to be so heavy and now it's like you're soaking a pad, or if you're noticing that you're cramping more than normal, or you're noticing that sexual intercourse is painful and it didn't used to be painful, those are all red flags, not necessarily just for cervical health, but for your reproductive health overall. And so it's really important that when something seems off, that you go get checked out.
Absolutely. And I just wanted to point out to our viewers and our listeners to please ask questions when you're getting these type of exams or procedures. I know myself, I had an ablation, but it was not explained to me. I didn't find out till afterwards that, when they've burned the lining of my uterus, I no longer have the cells to test for cancers when you go get a pap smear, because they burned them all. So
is that what an ablation is?
Ablation, yes, it burns the inside lining of your uterus. Now they're doing it with negative ions. They used to put scalding hot water in your bladder, in your uterus, and to get rid of that lining. Now they use ions to do it. But once they do that, that tissue is gone. So on a normal pap smear, they check for cells, but now my cells are not there for them to check. And so I have to go through a whole different process to make sure that I don't have any type of cancer growing. But that was not explained in detail at the time that procedure was done. So I just want to encourage, again, our listeners and our viewers to please ask questions. I know we covered this when we had Joseph Walters on the show, and he was saying the disparities in healthcare, and it's because we get white coat syndrome and we don't ask enough or the appropriate questions.
So let's ask another one, and that's an excellent point, because knowledge is powerful, and there's enough information out there in the public domain to write your questions down and then take them to your personal physician and build that trust in that dialogue. It's critical. So I think you went back to something you said, Yvette, where we have to take personal responsibility for balancing out the media. Well, here's yet another area that I would submit that that's the case here. We have to take personal responsibility for becoming a competent patient in our own healthcare and working with health navigators in hospitals and our doctors' offices, consulting our clinical friends, our friends who went to nursing school and medical school. I mean, you would volunteer the information. We can't be so embarrassed not to have the conversation, because you get one shot every day at the best health you could possibly have. And so one of the questions that I have is about endometriosis. We talk a lot about that. Is that something, and I know the answer, but for those who are listening to me, is it exclusive to women? And if so, why? And what is it?
So basically with endometriosis, you have the cells that should only be inside of your uterus start to migrate and start to be located in other areas in your pelvic area. And so what happens is those cells, even though they're outside of the uterus, they still are endometrial cells, which the endometrium is the inner lining of your uterus. So you have these cells that are supposed to respond to cues about, it's time for a period or cramping or whatever the case. You have these cells that are supposed to respond to those cues, but they're in other areas. And so that's why you have the pain and the different things that you have, because you have these cells that are someplace they're not supposed to be doing stuff they're not supposed to be doing.
Yeah, my sister suffered from that for absolute years, to the point where it was so debilitating, because she developed sciatica and it seemed to be associated with that. I've had sciatica just based on a muscle pull that was just beyond comprehension. So I can't imagine every month having that measure of pain. But I take that back. I did not know that answer as well as you have just explained it. So that really was a lesson learned for me right then and there. I've been very blessed that that's not my condition, but I know a lot of women do. What are some of the other types of conditions that we should be, looking out for that are commonplace?
So you mentioned endometriosis, uterine fibroids sometimes can be a big one. I had a hysterectomy, and that was the reason why I had mine, was because of uterine fibroids, which are basically non-cancerous tumors that can be either on the inside or on the outside. And as they grow, they start to cause problems. Again, they can worsen the bleeding in your periods. They can worsen your menstrual cramps, and can also make vaginal sexual intercourse uncomfortable. So uterine fibroids is one. Ovarian cysts is another, or even what's called PCOS. And PCOS is Polycystic Ovarian Syndrome. And that just basically has to do with your ovaries are kind of not working the way they're supposed to. And sometimes it involves having cysts on the ovaries, sometimes it doesn't. But some of those ovarian disorders can cause issues with the regularity of your menstrual cycle, and it can often affect fertility as well, because they go hand in hand. If your ovaries are not doing what they're supposed to do, then everything else kind of goes by the wayside.
Dina, I want to, before we run out of time, address this. And I know that, I feel pretty confident that Linda and you too, Dr. Christensen, may be able to identify with this, because this was kind of generational for women of color. And we talk about cleansing, douching, because we were taught, at least I was raised with the big red water bottle in the bathroom, that you were supposed to do this all the time.
In the tube.
Yes, tube on a hanger, and we were told it was a hot water bottle, right? I found out later it was not a hot water bottle. But can we just talk about the pros and cons of that? Because I know as a mom, I had to stop my daughter. She was doing it every day. but
Yeah.
it's supposed to smell. And I'm like, honey, no, you don't do that. Because again, social media is teaching them, about OCD on cleanliness, and there's nothing wrong with being clean, but there is such a thing as too much. So,
Right.
Dina, can you just
I'll let
kind
her
of
go ahead.
tap on that for a minute?
Yes. So the vagina is self-cleaning, and she is not supposed to smell like flowers or baby powder or anything like
Or
that.
fruit.
No, she's not supposed to smell. Now, it shouldn't be a bad odor. It shouldn't be a fishy odor or anything like that, but it's not supposed to smell like flowers. And I think that just really has to do with the whole mindset. For years, there's aspects of our bodies that we were kind of raised and taught to not embrace necessarily. And so that whole culture of douching, now currently you have like the yoni pearls and the vaginal steaming and all of those types of things in an effort to try to clean the vagina and get rid of odors and all of those types of things, when in reality, if you have an odor, you're just masking it if you try to douche and make it smell like flowers and everything, when you really need to get to the root of what's causing the odor. Is it like a bacterial vaginosis or a yeast infection or some other type of STD? It's like you're treating the symptoms but not getting to the root of it when you're doing those types of things. And it throws off the balance in your vagina. It throws off that pH balance.
And that's really important. That was a great question, Yvette, because you and I have talked about some of the subjects. We like to be a little edgy, quote unquote, to talk about the things that are taboo. You can come to this program and have that conversation, because we're going to open it up. We're going to talk about it. And that's a really big one, because oftentimes we have women who believe that their relationships are going to suffer without understanding that this level of natural smell or fragrance is what is supposed to happen. And that goes back to, Deanna, what you said about knowing your normal. And I think that that's a critical function. So we want women to embrace their unique scent as much as they embrace their unique handwriting and their unique voice. And really understand what is normal and what is not normal. So how would someone hear your podcast? Because we understand that you have an amazing podcast that you tape and you load up. How would they be able to come to you and be able to get more information?
So I am on Facebook. It's my name, Dina Weaver. And then also I have an Instagram as well. And that's Sparkly, SPARKLY_DNW. That's my Instagram name. And that's where I post them. I've been considering creating a YouTube. Several people have mentioned creating a YouTube channel, but currently Facebook and Instagram.
Outstanding. Well, this is such an important conversation, and we can have a part 2, 3, 4, and 5, because women's bodies are complicated.
Absolutely.
And very complex, as we all know. You had mentioned earlier about the fibroids and needing to have a hysterectomy. Well, I have to raise my hand. That's exactly why I had one as well with my ovaries.
Me too.
So that's at least 3 of us. We're African American women who have a disproportional suffering from fibroids. There's a lot of controversy around removal, a hysterectomy. You don't have to have them. You can treat your fibroids. I had fibroids on top of fibroids. And I was past what I considered to be, I was not planning to have any children in my 50s at that point in time. And actually I was in my late 40s. So for sure, that was no longer a process. So if it's not what your goal is in life, then why suffer?
Absolutely. That was the reason I had the ablation. Now, my physician took a different route, but I had fibroids as well. But by cutting the blood supply, which is what they did, they were able to shrink to nothing. Because I just didn't have the time to have hysterectomy. I said, I don't have time. I cannot be laid up in the bed. I'm on the road. You're going to have to do something else. And that was the choice that was made for me. So there are choices, want the viewers and listeners to know, talk to your physician and find out what's best for you. because again, when we had Mr. Walters on the show, he was talking about the overuse
Yes.
of hysterectomies in women of color. They seem to make that the go-to treatment when there are other options. So again, we can't encourage you enough to do your research and to ask the appropriate questions, especially if you're still in childbearing age and you want to have a child. Don't just, if they say, oh, you need a hysterectomy, don't just accept that answer. Do the homework and call around and get some help.
Get a second opinion, even.
Even maybe a third opinion.
Yeah.
I agree. And there's a lot of women out here that you can talk to and support groups. And if you are among our listeners and our viewers that have a cervical cancer, we wish you all the best in your treatment plan. And we hope that you will continue to get more information and be on social media, learn a lot from Ms. Watson and Ms. Weaver, and truly get into the know, and as I'm sure you are. So is there anything that we can do naturally in terms of our diet to support? We have just a few more minutes left. I think we're down to probably the last couple of minutes here. We have one more minute. Okay. Can you give us, as we go out, anything that we can do that supports us naturally?
So being your healthiest self is always going to be one of the best preventative things that you can do. So consistent exercise, drinking enough water, at least 64 ounces a day of water, not eating a diet that's high in sugar, all of those types of things, because obesity can contribute to uterine fibroids and cancer anyway. So really just being your healthiest self overall, not eating a lot of processed foods, eating more fruits and vegetables, proteins like chicken and poultry and things like that. Those are all things that you can do just overall, not only for reproductive health, but all health.
And can we just do very quickly make sure we clear up one misinformation, that the COVID vaccine has no contributing factors to any cancer that we know of at this point in time, particularly cervical cancer.
Also, that women should not stay away from being vaccinated because they plan to be pregnant or are pregnant.
Exactly.
And that is such a misconception. That's such a misconception. They need to be vaccinated, and not only before they get pregnant, but also in pregnancy, because it greatly increases the risk of complications in pregnancy.
Outstanding. Well, we see Anthony. Anthony, you have any comments? You learn anything? You appreciate women and our complications of who we are that God made us?
You had to go there. You had to go there, but
it's Wellness Wednesday.
I take the fifth and the peace route on this one. So I'll leave you guys to have that discussion. But yes, I do appreciate it. It's obviously it's complex. It's grown-up conversation, right? It takes a certain level of mentality and wisdom to be able to have this adult conversation. So thank you so much for that.
Yes, and thank you, Ms. Weaver. We appreciate you, and you're welcome back anytime.
Thank you for having me.
Yeah. Thank you for being with us.
You're welcome.
All right, guys.
Okay, that's a wrap.
All right, guys. So coming up next is the Bloomberg report. And then again at segment number 3, we'll come back and we'll do the segment on technology and e-commerce and look at our TV pre-launch, our Roku channel pre-launch discussion with our colleague, Michael Gerard, on our Tech Talk segment. So folks, have a good day. Ladies, great job as always.
Thank you.
Thank you.